Thank you everyone for being here and welcome to Oral Health and the Peer-Supported Recovery Journey. We will be getting started. We would like to acknowledge the land. The Northwest MHTTC honors the many cultures and lands across our region, spanning Alaska, Idaho, Oregon, and Washington. Next, we would like to introduce the MHTTC network. The MHTTC network is a nationwide network that's supported by the Substance Abuse and Mental Health Services Administration. Our purpose includes disseminating and implementing evidence-based practices for mental health issues into the workforce. The goals of the network include supporting mental health-related evidence-based practices, heighten the awareness, knowledge, and skills of the workforce, foster regional and national alliances, and provide and connect you to free training and technical assistance opportunities. Now about our Northwest Mental Health Technology Transfer Center network. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and technical assistance, or TA, in evidence-based practices in Region 10 of Alaska, Idaho, Oregon, and Washington. Our area of focus is evidence-based practices for serious mental health issues, such as psychosis. However, we provide training on a variety of topics, including integrated care, suicide prevention, diversity and equity issues, school mental health, peer support, trauma-informed approaches, and others. Our target workforce includes behavioral health and primary care providers, school and social service staff, and others whose work has the potential to improve behavioral health outcomes for individuals who live with or at risk of developing mental health challenges. We fulfill our mission by live events just like this webinar that are also recorded and posted, virtual learning communities, free self-paced online courses, newsletters, and the resource library on our website that we'll be sharing, as well as connection to other training centers and events. Now I'd like to share a note about language. It is our intention to always be mindful of using language that promotes recovery and culturally appropriate terminology, and we encourage all to use language that demonstrates respect for a person's dignity and worth. It is consistent with recovery-oriented practices and promotes environments that foster respect, human dignity, and hope. And we want to next review a couple of logistics regarding communications during today's webinar session. So first, we do have all attendees muted and not appearing on video. Chat is available and everyone can see what's in the chat. This presentation today is being recorded, and the recording and these slides will be made available on our website in a few weeks. You'll also receive an email from Zoom with a link to where these resources are posted on the website. And you will receive an email within 2 weeks on how to access a certificate of attendance. Please note that there are not formal CEUs available. If you're experiencing any technical issues, please use the chat and our MHTT staff will assist. And there is another option if you have content-related questions for today's webinar. That's the Q&A box. We will be monitoring the Q&A box to facilitate answering as many questions as possible. At the end of the presentation, we'll have some time for a Q&A session. So if you have any questions, please type them in the Q&A box at any point throughout the presentation. And please avoid putting content-related questions in the chat box, as we can't copy those into the Q&A box. So please do try to get those content-related questions in the Q&A box. We will be moderating and sharing questions with the presenters at that Q&A time. We might provide a short written response during the webinar or field as many questions as we can live, and we will do our best to get an answer to everyone. Lastly, I want to share a note on feedback. Your feedback really is appreciated and crucial to our work. So we would appreciate your response to a very short survey that takes just a couple of minutes after today's webinar. And our team will share that survey link in the chat box near the end of the webinar today. You'll also get an email reminder via Zoom with the email evaluation. We are required by SAMHSA to conduct surveys, but we really appreciate your feedback about this session and to plan future sessions. And your participation really helps to keep these free training opportunities coming. So I have just one more note, which is the disclaimer. SAMHSA sponsors this work, but does not take any official position on the content that is being shared today. And with that, I'm really excited to welcome you to the Oral Health and the Peer-Supported Recovery Journey that is presented by Janie Gullickson with guest panelists Reina Bauer and Kevin Fitz. Before I introduce Janie, I would like to launch a couple of polls because I'm curious to hear who is with us today. So our first poll that you will see coming up is, what's your role? We have a couple of options here: behavioral health clinician or therapist, case manager or outreach worker, education, school or school-based organization, nurse or other medical worker, peer support specialist, clinical supervisor, and other. And if you don't identify with any of those listed roles, if other is where you find yourself, please do share in the chat box what your role is. We're going to leave this poll up for about 15 more seconds. So please do let us know what your role is so we can get an idea of who our audience is today, of who's joining us. And I see already that peer support specialists, about a third of us today are peer support specialists, and about another third identify as other. So I'm going to check out the chat box and see behavioral health managers, staff to legislative advisory board, trauma-informed clinical trainer, dental hygiene instructor. Fantastic. Thank you all for filling that out. I am going to close our poll now, and I'm sharing the results with all of you. So you can see that we have about a third peer support specialists, about a third are other, some of those examples I just read, followed by 2 equals 16% behavioral health clinician or therapist, case management or outreach worker, followed by education, school or school-based organization, and nurse or other medical worker. Kind of interesting that we have matched pairs for everything: 31% peer support, 31% other, 16% case manager outreach, 16% behavioral health clinician or therapist, 3% education, school, 3% nurse. Kind of interesting today. And we have one more poll I'm going to launch now, which is specifically asking you about your work setting. What is your work setting? Criminal justice or corrections, educational setting, behavioral health clinic or treatment program, shelter or housing program, outpatient healthcare center, peer-run program, hospital, or other. And once again, if you do not work in any of the listed settings, if you connect with other, please do feel free to get that entered in the chat box, and we will check out and see what those other settings are. All right, I see so far we have almost half with other. So feel free to let us know what your work setting is in the chat, followed by 21% behavioral health clinic or treatment program. So we're going to leave this open for about another 10 seconds, and then I will be closing it. I see state agency for setting in the chat, community health center, FQHC, reentry. Great. Lots of settings being shared. Thank you all. All right, I'm going to close the poll. Thank you to everyone who participated in that. So real briefly sharing our results here. Almost half of you who are attending today, other, did not work in any of the listed settings. And then we have 23% of our participants today who work in a behavioral health clinic or treatment program, followed by 10% in an educational setting, 7% in criminal justice or corrections. Oh, whoops, and I missed the 10% in the peer-run program. Apologies about that. And then 3% in hospital settings. So thank you all so much for letting us know who is here with us today. Always interesting to see who is joining us for these webinars. So thank you all so much for doing that. And with that, I would love to introduce our presenter, Janie Gullickson. Janie is a person in long-term recovery, and for her, that means she has not used alcohol or drugs in over 11 years. Janie is in recovery from both addiction and mental health challenges, as well as homelessness, incarceration, and criminal justice involvement. She navigated all types of systems and institutions that can accompany such life experiences, from frequent hospitalizations to prison. Janie was released from Coffee Creek Correctional Facility in September of 2006 and first began her work as a peer support specialist / recovery mentor for Yamhill County HHS in McMinnville, Oregon in 2011. Janie joined the peer-run organization Mental Health and Addiction Association of Oregon as a project assistant in 2014. In May of 2017, Janie became MHAO's executive director. She also earned her Master of Public Administration Health Administration degree from Portland State University in June of 2017. Janie is passionate about social justice issues with a focus on mental health and addiction recovery, peer programs and services, and advocacy in these realms. And I am so pleased to turn it over to the fantastic Janie Gullickson today. Janie?
Thank you so much, Adrienne, and thank you all for your interest in oral health and how peers can play an important role in supporting people with their head to toes wellness journey. And if you are already familiar with how oral health is connected to the whole body and the whole body health, we're glad you're here, as well as for those who will learn about the connection to whole health and well-being and oral health. As a person in recovery myself, I've had my own experience with oral health. And after decades of drug use and years of mental health medications, I was very concerned about the impact those things had on my teeth, especially with my lack of dental hygiene over those years. So, as we'll learn, oral health is much more than just teeth and cavities. And even though my teeth were impacted far less than my gums, I still deal with periodontal disease and have been for years. So this is something that is very near and dear to my heart, as well as a peer support specialist, as Adrienne shared. I was for several years, and I supported people in exploring and accessing those resources regarding their oral health. And it was so rewarding to see the difference dental care could make in someone's life. Next slide, please. I'm also so excited to introduce to you our guest panelists today, Reina Bauer and Kevin Fitz. And I am going to share a little bit about them, and you'll hear from them directly later on in the presentation. Reina Bauer is a person in long-term recovery, and what that means to her is she has not used drugs or alcohol since April 1st, 2010. Her past consists of using and abusing drugs, losing her 2 beautiful children to the Department of Human Services, countless times of being arrested in and out of county jails, and 4 years of incarceration in a state prison. Reina is also one of MHAO's amazing Evolve Peer Service directors. Reina shares that recovery has given her a life she never dreamed possible, and today she is a wife, a present mother to her children, a daughter, and someone others can count on. Her passion is to help and to offer support to others throughout their journey, and she believes all people can and do recover. Thank you for being here, Reina. And Kevin Fitz is the Executive Director of the Oregon Mental Health Consumers Association, or OMCA. Kevin serves on many councils and committees on the national, state, and local level. Kevin has led the way for people with lived experience in Oregon to have seats at tables with elected officials and decision makers. Kevin's most recent advocacy effort included a huge win as peer respite was funded and put into Oregon statute just this legislative session. Congrats, Kevin. Kevin's first experience of the mental health field occurred when he was a patient involuntary committed at 19 years old. After experiencing a few years of instability, including extreme states, hospitalizations, homelessness, trauma, substance use problems, and other difficulties, Kevin found peer support and developed ways to cope with his challenges with self-care, especially self-management of diet, exercise, and sleep. Kevin still lives with disability challenges, but directs his energy towards policy behind state-of-the-art long-term rehabilitation, peer support, peer mentoring, and the role of technology tools for empowering individuals living with disabilities and different abilities. We're glad you're here, Kevin. Thank you. Next slide, please. So let's start with that question. What is oral health? It means so much more than just healthy teeth. The American Dental Association defines oral health as a functional, structural, aesthetic, physiologic, and psychosocial state of well-being and is essential to an individual's general health and quality of life. So we'll translate that into more layman's terms that is familiar to me. Oral health refers to the health of the teeth, gums, and entire oral facial system that allows us to smile, speak, and chew. According to the first ever US Surgeon General report on oral health in the year 2000, oral health means much more than healthy teeth. It means being free of chronic oral facial pain conditions, oral and pharyngeal or throat cancers, oral soft tissue lesions, birth defects such as cleft lip and palate, and scores of other diseases and disorders that can affect the oral, dental, and craniofacial tissues, collectively known as the craniofacial complex. These are tissues whose functions we often take for granted, yet they represent the very essence of our humanity. They allow us to speak and smile, sigh and kiss, smell, taste, touch, chew, and swallow, cry out in pain, and convey a world of feelings and emotions through facial expressions. Next slide, please. So the Health Policy Institute and the American Dental Association conducted surveys across the US in 2015. And what they found in their very comprehensive report, and the link is at the bottom of this slide and will be accessible after the presentation. They found that attitudes are generally pretty consistent across income levels and age groups. And I also saw that through the report, you could click on any one state and find out more details about the report as it pertained to that state. But overall, 97% of people surveyed valued oral health, and that was pretty consistent across all states. Some other notable statistics were 1 in 4 adults, though, avoid smiling due to the condition of their mouth and teeth. 23% of adults feel embarrassment due to the condition of their mouth and teeth. And 1 in 5 adults experience anxiety due to the condition of their mouth and teeth. That being said, though, 77% of adults say that they plan to visit the dentist within the next year. And in reality, 37% of adults actually visited the dentist within the last year. So there are a few reasons for that. And the top 3 were the cost of dental care, fear of the dentist and dental care in general, and probably for some very valid reasons, and then inconvenient location. So barriers to actually getting to the dentist were standing in the way, and some reasons for not going to the dentist regularly. Next slide, please. Now we will watch a video and learn about the mouth-body connection.
Hi, I'm Heather Brown. I'm a dental hygienist and a director of oral health with Delta Dental. We all know that the mouth is connected to the body physically, but how is it connected physiologically? The mouth is the gateway to the body. If your mouth isn't healthy, how is your brain going to be healthy? What about your kidneys? What about your pancreas? What about your lungs? It affects so many parts of us, and so we have to understand the connection. The brain and our oral health may seem like worlds apart, but they're really not. If you have periodontal disease, it actually can impact your whole body, but also your bloodstream, which blood goes to your brain, and you have a higher risk of blood clots and stroke. The #1 problematic oral health issue is periodontal disease. It causes a person to be at 2 times greater risk for heart disease and possibly a heart attack. So we want to make sure that our periodontal disease is in check and in control. The lungs. Poor oral health can lead to worsened respiratory ailments, which can be pneumonia, for one. The germs in your body or in your mouth. They multiply and they can cause these types of infections. The pancreas, it might not mean much to you, but if you're diabetic, it should. Diabetics are already at a higher risk for having periodontal disease. Periodontal disease can impact controlling your blood sugars. So it's really important that your oral health is pristine. The kidneys filter disease from all the other body parts. So if you have disease in other areas of your body, you're making your kidneys work overtime. Make sure that you keep your mouth nice and clean and that you drink a lot of water and stay hydrated. That helps flush the kidneys. Why are your bones important to your teeth? The jawbone is a supporting structure of your mouth which holds your teeth in. So if you struggle with osteoporosis, your bone may be affected, you can have tooth loss. We don't want that. There's some essential things that you can do for the mouth-body connection. Brush your teeth twice a day for 2 minutes each time. Make sure you floss daily. If you smoke and drink, maybe think about changing that habit. Eat a healthy diet and make sure that you see your dentist on a regular basis. If you're ill, it's really important to stay on top of your oral health. So make sure that you keep your mouth in tip-top shape by brushing and flossing even when you don't feel good. The secret to long life is in your head, like literally.
So now hearing about the mouth-body connection, we take that even a step further and how oral health and mental health are connected. And so Mental Health America National and Families USA took a deep dive into that connection between oral and behavioral health. And they quote the US Centers for Disease Control and Prevention, who estimates that over their lifetime, 50% of Americans will be affected by some type of behavioral health issue. In 2016, an estimated 45 million adults in the US lived with a mental illness, including 10.5 million people with a severe mental illness. People with mental health conditions contend with a variety of challenges that can impede oral health and, by extension, their overall health. The connection between the two is bidirectional. Oral health problems are often exacerbated when a person has behavioral health needs, and mental health is likely to be made worse by poor oral health. So again, can't overstate it. Oral health is critical to overall health, yet it is an often neglected part of healthcare and receives less than its fair share of attention and resources. Lack of awareness about oral health and access to comprehensive oral care often has extremely negative impacts for people living with other chronic conditions, including diabetes and heart and lung diseases, and those with behavioral health conditions. Next slide, please. And related to that is oral health and substance use disorder. Drug use affects oral health directly through things such as dry mouth, clenching and grinding of teeth, and chemical erosion from direct exposure to substances in the teeth and gums. They may also be a lifestyle component that often accompanies drug use and addiction that affects oral health through high sugar diets, malnutrition, poor oral hygiene, and a lack of regular professional dental care. And now I would like to welcome guest panelist Kevin, who will be sharing a bit about his journey related to oral health. Next slide, please, and welcome, Kevin.
Very good. Thank you very much for having me here today. The three things I want to put a pin in my story here is the issue of poverty, the issue of trauma, and the issue, I guess the word for it that I use is paranoia. But the first experience that I had with dental care was as a young preteen. I busted my front tooth in a wrestling match with my brother. I got that quickly repaired, I don't know, at age 12 or age 13. And they got that fixed. Unfortunately, my family dynamics fell apart at age 13. My father's alcoholism, my mother's drug addiction, and some of her mental health symptoms tore our family apart. And I was under my father's care, who was a full-time practicing alcoholic. And it wasn't that we couldn't afford dental insurance, things were just not coordinated enough with dad and his drunkalogs and the challenge of getting adequate health care for his two sons that he was had custody of. So one of the first challenges that I had is I had this tooth that was repaired at age 12, but at age 13 and a half and 14, that the functionality of that tooth started to fail. And so part of the tooth broke off. This is particularly difficult for me at age 13 and 14 when I'm trying to meet girls and trying to look, like I'm part of the cool gang in a very upper middle class, but public high school. I was teased and mocked and made fun of. That the nickname that the jocks used to call me was Chip, because I had a chip in my front tooth, and it made it seem like that we were poor or unable to afford dental care. And it was very difficult for me to understand why people were teasing me about something that was not particularly, it was beyond my control. There was attempts later on to sort of remedy that tooth in my later teens. But one of the things I realized is the trauma that I experienced being bullied and beat up is that I had a great fear of sort of being in a vulnerable state with a stranger that close to me. So I avoided particularly dental care until the age of 21 years old. I was working for a peer-run organization, and I was talking to a fellow peer about my challenges and how much difficulty that I had sitting in the dental chair. And they recommended somebody that they had seen, a dentist that they had seen and that they had known about some of their trauma history and some of their challenges with fear and trauma and being close to strangers. And then ultimately it was, like I said, a fellow peer in my workforce who recommended me to a particular dentist. And that was fantastic. And that led to 12 years of really good sort of dental care, hygiene, good treatment of my gums, et cetera, et cetera. And I was on a really good path for all that. Unfortunately, in 2002, you can see by this picture, in 2002, I fell back into significant challenges with my alcoholism and extreme psychotic states. And so for a period of 7 to 8 years, I had total neglect of my teeth and my gums, not just dental care, but just daily oral hygiene and flossing. I don't know if you've ever had the experience of being psychosis, but the days all melded into sort of one big, torment. And a lot of my daily routines and self-habits went out the door. One of the issues about coming back to getting dental care, and this was probably in about 2010, 2011, is that I was very self-conscious of how bad my teeth looked, what it said about me. I was sure that the rest of the world, and particularly the dental office, could see this man is paranoid. He looks like a homeless, dangerous creature. And I was really affected my sense of shame when I went to the dentist office. However, one of the things that was really fabulous was the sensitivity of the hygienist and the administrative clerk. They never actually expressed it directly, but they had told me in later years they could see how much I was suffering and how sensitive I was and fearful I was about the experience and just being around strangers. It triggered, the issue of not trauma so much or paranoia, but just the sense of being an outcast or a person in poverty or a person, who was severely mentally ill and was unable to take care of themselves. That moved forward, and ultimately that relationship with that dentist is still going on. I actually had 15 crowns. So I sat for 40 hours in a dental chair with a hygienist holding my hand holding my shoulders or comforting me while the dentist, fixed my teeth, put crowns in there. I had 4 years of braces, gum. I had serious periodontal disease. The one thing particularly is that I wanted to abandon this because I was very nervous about sitting in the chair, hallucinating, and I got tremendous support for a few peers in my life. One of them is my life partner, to stick with it, that this was a worthwhile investment. And even though I might feel some shame or some humiliation in the process, that the long-term goal, the long-term goal of having my oral health and my teeth back would be a journey well worth it. And it certainly was. The interesting thing is now today, I still go to that dentist office for deep cleaning 4 times a year, every 3 months. And they have said to me, because they've seen me on radio or TV or talking about this or that, and they said, wow, we did not know the extent to the degree that you were having challenges with your mental health, but we knew that you were in pain and suffering, and we really wanted to make sure that you felt comfortable and that we weren't judging you. And it's really tremendous to see your smile and to see your political and policy success. And that is just wonderful. That is just such a wonderful ending. It's an ongoing journey. I still live with some periodontal disease. It has also impacted me as a peer in my relation to other peers in my life. I have two very good friends in my life who are struggling with oral care issues that are so complicated. It's raising their blood sugar, it's raising their blood pressure and affecting their heart. And I'm always looking for those gifted people who are able to introduce this subject without triggering trauma, fear, one sense of being in poverty, or paranoia. And I'm not sure exactly if I have the correct words, but I do have some sense of inspiration in the way that the peers and my friends and the dentist office particularly worked with me over, an 8-year process of helping me feel comfortable and accepting me for where I was at, even though I felt I looked like a monster and unlovable and shameful, in the condition that I had become. So anyway, that is my story in sort of a nutshell. I don't know how much time do I have left, timekeeper?
Thank you, Kevin. This is your 1-minute reminder.
Okay. All right. I want to say too, and the thing growing up is it's the horrible thing coming into puberty and being afraid of your mouth, being afraid of your dirty teeth, even as a 35-year-old man, having all those broken out, I see pictures of myself where my partner or family is telling me to smile and I'm tucking down my lip. I mean, and then, and go out to the shopping mall, just being very embarrassed and self-conscious of, I look dirty. This makes me look, like I have a serious mental health issue, like I can't take care of myself. And so that sense of shame is a long time sort of processing. And I think I still deal with that, particularly about my appearance and my dental health. But I do feel proud now when I see myself on video or on TV or whatever, is that my smile and my sense of pride about it has been restored and recovered. And so that's very, very positive. I'm grateful to be here today. Thank you for inviting me.
Mm-hmm. Thanks, Kevin.
Thank you so much, Kevin, for just your courage in sharing your story today and for the several-year journey of caring for your oral health has been for you. So just thank you for that. Next slide, please. And as many of us know in the peer field and maybe in our own personal lives, recovery is possible. As Reina shares, people can and do recover. And so there's oral health and recovery. And it is, as you have heard in Kevin's story, how vital our oral health is to our self-esteem, our ability to talk to others, to get a job, housing, etc. And we will hear more in the video. Next slide, please, about recovery and oral health.
Drug addict, homeless, living on the street. I used to shoplift on a daily basis to support my habit.
Meth and heroin left Destiny Garcia's teeth looking like this. Help was coming in the form of dentistry students.
Go ahead and close for me.
The students were part of a program devised by the school's vice dean, Glenn Hansen. He'd long suspected oral health would improve drug rehab, and the program proved it.
They noticed that those who are getting comprehensive dental care as part of their treatment, they stayed in treatment for substance use disorder 2 to 3 times longer.
Study participants stayed in rehab 300 days compared to 100 days for those who didn't get care. They were 2 to 3 times more likely to get a job and stay off drugs. And Dr. Hansen says homelessness almost disappeared.
Good things are going to happen, both in terms of getting a job, presenting yourself. When you look in the mirror, You have a better feeling about who you are.
Salt Lake County Mayor's Office is Destiny. How can I help you?
The study's authors don't say why the dental program works, but Destiny knows.
When you're in a drug treatment program, you're working on your insides so much. And if you don't work on those outsides to match the way you feel on the inside, people are still going to judge you the same.
She says her new teeth mean new possibilities and allow her to kiss her baby and her family without hiding her mouth. I'm Marty Salt reporting.
And so there, I'm sure, are countless stories of people navigating either their mental health, their addiction, or both, and their recoveries, and how important oral health care became. So here we are, and the pinnacle of the presentation, if you will, where peer support can play a vital role in helping people navigate that journey of oral health and getting back into dental care. As many of you know, there's magic in the peer support relationship. It is such hard work, and it's also deep heart work. So we please help me welcome Reina Bauer as she shares how she was able to support someone through their journey of recovery that included oral health and some difficult conversations. Thank you, Reina.
Thank you, Janie. And thank you, Kevin. And thank you all for having me. You know, I was sitting here just, reminiscing and thinking about, I really always want to bring my most authentic self to these things that I get to participate in. And so I just want to say that I too can relate to a lot of things that have been said today and what has been shared in the slides. When I got out of prison this last time in 2010, I was thinking when I was going to share, and I hadn't planned on this, but like, my teeth are not my own. And that's not something that you usually start a meeting with, right? Especially on a Zoom meeting, I get to get really vulnerable and tell my truth. And so the fear and the trauma and the not being able to go to your children's events because you didn't want to smile or hug them, of embarrassment, shame, and fear. And for me, it was when I got out of prison this time, and they told me that they all had to come out, I was worried about the pain pills. I was worried about changing one addiction for another, and my body not knowing if I was using heroin or taking an oxy for the pain. And so a lot of fear came behind that. So I just want to start with that. And again, thank you for having me. And I want to share a little bit of a story about a couple that I supported throughout my journey. I've been in the field for about 10 years, and it was newer in my peer work. And I met these two individuals that lived in Clackamas. I met them behind a dumpster at the Red, White, and Blue store. I was walking out, and it was later in the afternoon, and I noticed some people behind the dumpster. And so I went over there to see if they needed anything. And they were both pretty broken, and they had said that their children had just got removed. And in a deeper conversation with these two, I found out that the woman was actually on SSI and had a payee who was taking her money. And so brought them to my office and found out they had a desire. They had a desire to stop using, and they had a desire to get their children back and be housed. And so through a lot of relationship building, we were able to get them into recovery housing, which then started the process of getting these babies back. And there was a lot of hoops that they had to jump through. And one of the things that I really noticed was, yes, the female had really bad breath. And, I noticed it in my car. I would take her to recovery meetings, and people would talk about her on the side. I would take them to court. I would take them, and I have strong relationships today with Department of Human Services. Like, I honor everybody's voice at the table. We all bring a really great piece to the team in supporting the individuals. So, but I would leave these meetings, and my peers would walk out, and I would hear DHS caseworkers talking about and kind of cackling about well, we didn't really want to sit by her. We don't want to sit by her because her breath's so bad. We can't. And those were the conversations. And, you know, due to lack of health insurance, when I met these people, that was one of the first things that they wanted to work on, was getting OHP, the Organ Health Plan. And so through that process, we were able to get them both connected to doctors and dentists. And it was the one last time that I had, and I just had the conversation with the peer that I was working with, like, oh my gosh, this is the perfect, how long's it been? She couldn't even remember the last time she'd been to the dentist. And I was, and through conversation and transparency and authenticity, I was able to say, like, you have some stuff going on, you have health insurance, let's get you into the dentist. And through that process, and fear came behind that, because she hadn't been in so long. So I was able to meet her right where she was at and go with her and really hold her hand. And through that process, yes, she had all of her teeth were rotten in the back. Most of them were broken off, and that was causing the bad breath. And through multiple DHS meetings, I wanted to talk to the agency and let them know, like, that I had noticed in my most loving voice that I had noticed that they were talking about her and not to her. And this is what we had did. And it wasn't for lack of not wanting to go to the dentist. It was by not having the means to go to the dentist, because she used when she didn't want to, and she had a disease and didn't know how to stop and was unable to take care of herself. You know, and those two individuals, you know, her oral health became a priority. There was fear, but she showed up with me by her side. And this isn't to make a joke or to be funny, but the gentleman, we were on we were headed to court, and he was in the back seat of my car, and he ended up taking his shoes off. And I'll just say his name was Tom. And I was like, whoa, Tom, what is going on back there? And he had taken his shoes off. And through that, I had asked him, okay, well, you're going to have to put those back on. Like, and we had a conversation, and he hadn't had a new pair of shoes in roughly 3 years. And most days he didn't have any socks. And so you talk about going to Fred Meyer and seeing somebody so grateful. I said, as soon as we leave court, we're going to go and we're going to get you some shoes, and we're going to get you some socks. We're also going to get you some baby powder, and that's going to prevent. And so we just were able to, you know, and I've continued to work in the field, and I've continued to keep relationships with judges in my counties and Department of Human Services. And it's one thing that they remember about me and that conversation is it opened their eyes and their perspective to be able to have these conversations. Some of them had never done that before. You know, they were in the corner and they really acknowledged it. And so there was a lot of good things that happened that day and through that process. And, you know, I shared a little bit in my bio, and Kevin kind of touched on it a little bit too, like growing up in an alcoholic family. It wasn't my parents' top priority to get me healthcare and to take me to the dentist. And so, you know, moving forward, I also mentioned in my bio, I'm a good mom today, you know, and my daughter is 9 months into braces, and it's very important to me to be present. And so I probably haven't taken up all the time, but I just wanted to share that with you all. And thank you again for just allowing me to speak today. Thank you.
Thank you so much, Reina, for your courage and bravery and sharing your own lived experience, as well as what an incredible role you played as a peer supporter to those you were supporting, and having those difficult conversations and being an example of how life-changing just having an uncomfortable and difficult conversation can be in a positive way for someone. So, you know, what can be 5 minutes of what feels very uncomfortable can bring years of positive changes and support. And people, I think, in the end, appreciate that for sure. So again, thank you. And that is our presentation on oral health and the mouth-body connection, how peer support plays a vital role in supporting people in recovery, navigating recovery with their whole health and oral health. So just thank you very much for sticking with us today, and I'll turn it back over to Adrienne.
Thank you so much, Janie and Reina and Kevin, for all that you've shared and all of the heart and the information that you've really brought into this topic today. There are a couple of oral health resources that we wanted to share with all of you. As a reminder, these slides are going to be shared out. This webinar is being recorded as well, so you can return to these resources if you would like, including Give Back a Smile, Cosmetic Dentistry Grants, the Mouth-Body Connection book, the American Dental Association, and that 2000 report that Janie had referenced earlier on in the presentation, the first oral health report from the Surgeon General. At this time, we are going to see what questions there are. And I see there is one question in the Q&A box, so I will read that and then open that up to our speakers today. This is from Jessica. What kind of advice can you all give to start the conversation about oral health? Thank you for the question, Jessica. Janie, Reina, Kevin, are there any thoughts on advice that you can give to start the conversation about oral health?
Yeah, I mean, I can a little bit. I think just transparency and taking the elephant out of the room. Most of us, I'll speak for myself, I already know that there's something going on. And I was so afraid to, so I think just sometimes asking permission and starting with how long has it been since you've been to the dentist? How long has it been since you've been to the doctor? Is there anything I can support you with? Is there anything that's hurting? Is there, I had tooth pain that was, and I think just short answer, I think transparency and authenticity, because we already know, for me as the addict who hadn't been to a doctor or a dentist in so long, I already knew there was something going on, but there was so much guilt and shame behind the way I looked that I wasn't probably going to be the first one to start the conversation. So I think just, being genuine and then following through. That's my 2 cents.
Thank you so much, Reina. That is great advice. Really, that transparency, authenticity, and connection is wonderful. Janie and Kevin, do either of you have any additions you'd like to say as far as advice?
I'd just like to say, I often, when I'm talking to a peer or a friend, that sometimes I find leading with my own experience, instead of, I can be somewhat aggressive in asking questions or poking at them, but I always find that sometimes it helps leading and talking about my particular experience and the issues that I went through with paranoia and trauma and, shame, and talk about that experience, and then, hope it provokes in them, and it adds the 2 people that I mentioned that are in my life that I'm concerned about. I always open up the conversation, not like I'm meaning to strip mine them for answers or for them to talk about their issues, but just lead with mine. And it usually, most times leads to them talking about their issues or their concerns to some degree. So.
Thank you so much, Kevin. All right, Janie, did you have any additions to make?
Yeah, I just appreciate what Reina and Kevin shared, and in some experiences that I had supporting people, the conversation came about from other topics and other health concerns. One peer in particular was sharing, that she had type 2 diabetes, and the doctor was suggesting, she eat whole foods, more fresh fruits and vegetables. And she did not have any teeth. And so she did not know how she was supposed to eat celery or carrot sticks or apples without teeth. And so she had volunteered that information. And my response was, would you like teeth? And she said, well, yeah, but she was on Medicare. Medicare doesn't cover dentures except for, I think at the time it was every 5 years or something, but that got the ball rolling. And so we eventually were able to get her into the dental school here in Portland, Oregon, and then found all kinds of people from her relatives to the Seroptimus Club that were willing to help fund a new set of dentures for her. And it was a long process, but we got to do a lot of other peer support in those drives to the dental school and became quite close through that whole process.
Thank you, Janie. And thank you again, Kevin and Reina, as well, for all the helpful advice that you've shared. We have one more question that I see. This one came to us through the chat from Elia. We sometimes have patients that have signs of drug abuse in their mouth. How to break that question to patients, to the folks who are receiving services? Any thoughts on that?
I don't know. I always felt like that the gig was up, that when I was suffering and under, struggling with my alcoholism, that it was very apparent to everybody if they would just take a look at me. I don't know exactly. Maybe Reina or Janie has another way to talk about it.
Could you repeat that, Adrienne? I'm sorry.
Yes, absolutely. The question reads, we sometimes have patients that have signs of drug abuse in their mouth. How to break that question to patients? So I'm understanding it as someone let's say in the dentist's office, the person providing the services notices that there's some signs of drug abuse in their mouth. How to start that conversation? Do you have any thoughts around that?
I'm thinking.
Mm-hmm. It is a great question.
I'm sorry. So drug abuse in their mouth,
Mm-hmm.
that is the question. And I'm sorry, is the question that maybe the dentist notices that their teeth are bad due to their drug addiction. So a dentist. Okay.
Yeah. So a dentist, dental hygienist, someone working in a dental office, they notice, I'm seeing some signs that there may be some substance use happening here due to what they're seeing.
I don't have a lot of go ahead.
Oh, I was just saying, I actually see from Jessica in the chat, she has shared, or they have shared a comment as well that says, I would start with asking if they've ever used any substance and take the conversation from there and maybe explain risks. Thank you so much, Jessica Angel, for sharing that.
Yes, thank you, Jessica, because I'm just trying to pull my lived experience into this. And as I just think throughout my disease, I'm not sure I ever went to the dentist. So that I had never, and a lot of people that I have supported, it's either been for an abscess where they're going to the emergency room and it's really quick. And you're right, the conversations have never really happened, or people their first desire, their desire is not to go into a dental or a doctor's office when they're using. So you got me there, and I'm going to think about it because, I always, today, transparency, I'm really, big on that, but that also I feel potentially could scare somebody away who's coming for help. So I'm sorry, I don't have an clear answer for that on what I would.
And Nicole Matz has another suggestion saying, could you simply say, hey, I've noticed, and then ask if they have any concerns about their oral health?
I think that's great.
Mm-hmm. Great suggestions. I love how people who are participating in this webinar today, you all have so much knowledge and experience and so many things to contribute. So we really appreciate that. We have just a couple of minutes left. I'm wondering if there are any final comments on that question about how to start the conversation if someone who is working within a dental office, within the dental field, has noticed signs of some substance use. Just checking in with Janie or Kevin to see if you have any final thoughts on that before we wrap. Janie, I see you.
Thanks, Adrian. Yeah, I wonder, I guess for the folks in the dental field on the webinar, is there a protocol for maybe tobacco use conversations? And if so, and I also see there's, the important topic of potentially some eating disorders, signs of that. So just wonder if there is protocol already in place with tobacco products, that if that could be put into use as well for other substances.
I just want to add to this. I think it's an important issue, but there are certainly at times that I went to the dentist, but I was not particularly wanting an intervention for anything else in my life. I know as health professionals, but the issue, at least particularly for me, with behavioral health and alcoholism and the paranoia, sometimes I felt as if that wasn't what I wanted, that I was going there for. And thankfully, I wonder if that would have scared me away of like, no, I'm not here to get treatment for that, or for you to nose into my personal business and put this on my dental record. And so I understand as a health professional, it's important to bring up some things, but you don't want to scare away the client, by looking like, this is going to go down in your permanent record. And, stuff like that. I mean, people have a tendency to not want to admit it. All of my medical records say that I'm an alcoholic and that I have schizophrenia, and I probably will be following me around for the rest of my life. And I guess that's probably where peer supports could actually come in and help bridge and bring up conversations, or help channel communications that don't seem threatening, or like someone's narking you off or going to narc you off, if that makes sense.
Thank you, Kevin. That's a great point. And I would like to share a final thought for something that all dental offices, all offices everywhere can do, is have resources available. So that can help us to normalize the conversation. So maybe if the person isn't quite at the point where they would like to explore that with the dental assistant or hygienist or dentist, but maybe walking through the lobby, they go, oh, wow, here's a resource for free peer support, or here's a place where I could get connected to talk about substance challenges or whatever it may be. So having a variety of resources available really can be helpful, especially those resources that require no person-to-person interaction. So I can casually walk by, grab a brochure, don't have to feel like a person is outing themselves to anyone. That can feel a lot more comfortable and safer as people consider, are there things I would like to connect with in the future as far as services? So I want to thank our excellent presenters so much for all of the fantastic information and vulnerability of personal experiences that you all have shared. Janie, Kevin, and Reina, thank you so much. I do want to highlight that we have a short evaluation survey that has been shared in the chat. Please do fill that out if you have a moment to do that. You'll also be receiving an email reminder with the evaluation link as well. And just another quick reminder, you can find out more about the network and register for additional resources and trainings just like this at www.mhttcnetwork.org/Northwest. You can sign up to receive the newsletter, email with any questions, or find us on social media. So thank you all so much for your time today, for your excellent questions, and for your participation and engagement in this webinar. And one final thank you to our fantastic presenters.
Thank you, Adrian, for facilitating.
Thank you all. We will be closing the webinar shortly. Recording of the webinar and the slides will be available within a couple of weeks. Thank you all so much.